I'm sure you've heard someone say or joke about having a panic attack. But panic attacks are very real situations where a person has a sudden period of intense fear that something bad is going to happen and that there's some imminent threat or danger. These feelings are often so intense that they are accompanied by physiological symptoms such as palpitations, sweating, shaking, and shortness of breath. In order to be characterized as a panic attack, the Diagnostic and Statistical Manual for Mental Disorders, the 5th edition, or DSM-5, says patients need to have an abrupt onset of 4 of the following 13 symptoms: pounding heart or fast heart rate, chest pain or discomfort, sweating, trembling, shortness of breath, nausea, dizziness, chills, numbness, feelings of choking, feelings of being detached from oneself, fear of losing control, and fears of dying. While there is not just one explanation for the cause of panic disorder, there are certain perspectives researchers use to explain the disorder. The first one is substance abuse. Substance abuse is often correlated with panic attacks. In a study, 39% of people with panic disorder had abused substances. Of those who used alcohol, 63% reported that the alcohol use began prior to the onset of panic, and 59% of those abusing illicit drugs reported that drug use began first. The study that was conducted documented the panic-substance abuse relationship. Substance abuse began prior to onset of panic, and substances were used to self-medicate for panic attacks by only a few subjects. Tobacco smoking increases the risk of developing panic disorder with or without agoraphobia and panic attacks. Smoking started in adolescence or early adulthood particularly increases this risk of developing panic disorder. While the mechanism of how smoking increases panic attacks is not fully understood, a few hypotheses have been derived. Smoking cigarettes may lead to panic attacks by causing changes in respiratory function. These respiratory changes in turn can lead to the formation of panic attacks, as respiratory symptoms are a prominent feature of panic. A number of clinical studies have shown a positive association between caffeine ingestion and panic disorder. People who have panic disorder are more sensitive to the anxiety-provoking effects of caffeine. One of the major anxiety-provoking effects of caffeine is an increase in heart rate. For some people, anxiety can be greatly reduced by discontinuing the use of caffeine, as anxiety can temporarily increase during caffeine consumption. Clinically, a combination of psychotherapy and medication often produce good results. Although research evidence of this approach has been less robust, some improvement may be noticed in a fairly short period of time, in about 6 to 8 weeks. Psychotherapy can improve the effectiveness of medication, reduce the likelihood of relapse for someone who has discontinued medication, and offered help for those people with panic disorder who do not respond at all to medication. In conclusion, panic disorder is something serious and not to joke about. In any cases where you think you have had panic disorder, seek assistance from a psychotherapist immediately.